On September 18th, 2017, Dominica experienced the fury of Hurricane Maria. The island, still fragile from Hurricane Erika in 2015, was hardly prepared to face this fury of nature once more. The rains generated a volume of water never before seen on this small island. The subsequent flooding was unforgiving, as this Category 5 hurricane with winds upward of 155 miles per hour became the perfect storm. Disasters on this scale all have a common signature: devastation. And devastation it was on an epic scale. Being unprepared, coupled with living in areas prone to flooding and landslides, the exposure to this massive hurricane was the recipe for disaster. PAHO's responsibility is to prepare countries to face emergencies, but in the immediate aftermath of a disaster, it is to help with the response, the recovery, and the rehabilitation.
The PAHO disaster management program is over 30 years old. But this time, because of the Hurricane Irma and Maria, which affected so many countries in our region, our operational capacity is tested. Everything we learned, everything we did in disaster preparedness, together with national authorities, is tested also. We are still in the phase of humanitarian assistance, but soon early recovery projects will have to start.
PAHO dispatched emergency medicines, vaccines, large capacity water containers, supplies and equipment as it engaged government agencies, especially the Ministry of Health and other stakeholders, to strengthen the health systems in the aftermath of this disaster.
Following what is one of the worst disasters in recent history, and a disaster that is compounded by our terrain, a disaster that was compounded by the lack of communication, and still the difficulty in accessing some communities. From health, I also want to commend the health staff. The health professionals of Dominica have paid really yeoman service to this country, working even when they themselves had suffered losses.
One of the things we do to activate our disaster plan is to ensure that the pharmacist remains at the pharmacy so that, for easy access. And that we did. Of course, the person who did that, that time was Mr. Peter Prosper. And thereafter, when the storm actually took place, then we have somebody who will come second, that is, if there's clearance on the road. And as you know, Mario was very devastating. So the person who was second, which was me, to come, I was actually cut off. There was no way I could come to rescue him. And then, of course, communication was there. But knowing him, he stayed and he held the fort, ensured, in spite of the fact that the pharmacy roof itself was gone and he was being flooded by water. The drugs itself wasn't affected in terms of getting wet, because there's an area that is covered with concrete, but there's an area that, apart, there's a roof on top of that. He still stayed and weathered the storm until help came, and then when all of us kicked in. And since that day, we have been at it. We have never stopped one day dispensing for patients, because patients, they're on insulin, they're on life-saving medicines, and we have to take that into consideration. In spite of the fact that we ourselves, like me, my roof was gone totally, and I never missed a beat.
And even bringing patients into whatever was left of their homes to deliver services and working long hours. So I really would like to acknowledge and commend those healthcare workers. We are here as PAHO, and our responsibility all over the Latin American Caribbean region, as it deals with emergencies, is to prepare our countries to face emergencies, but in the immediate aftermath of a disaster, to be there. If we can pre-position, we do, to help with the immediate response, and also to help towards recovery and rehabilitation. So we were here, as you heard the Prime Minister, from the first day, and immediately we began to mobilize for the response, but to work closely with the Ministry of Health and to help with the coordination of the health response, taking into consideration all of the assets that are available from neighboring countries, from entities who are on island and also off island. So this is what our responsibility is under the UN humanitarian arrangements. I have met with the Chief Medical Officer, with the Minister of Health, with the Permanent Secretary, the Director of Primary Healthcare Services, and all of the managers of the Ministry of Health. I met them in the OSC yesterday and had private meetings with them.
But PAHO has been exceptional in assisting us in rationalizing our health situation, advising us on matters we need to pay attention to, sourcing a lot of our pharmaceuticals and medicines, and ensuring that Dominica has adequate supplies, and where we're short, they have been able to source the specific medicines required on island. They've also been coordinating, in large measure, the external human resources in various areas, and helping to coordinate the presence of a number of health and medical professionals on island.